Hello, and welcome to the Safe Place Exercise Education for Professionals. I'm Leonie White, clinical family therapist and psychologist, and co-director of the Queensland Institute of Family Therapy. And I'm here together with my co-director, Kate.
Hi, so I'm Kate Owen. I'm a clinical family therapist and a clinical psychologist in private practice and at QIFT.
Great, thanks, Kate. And so together we've started the Queensland Institute of Family Therapy. And for more information, you can visit our website, www.qldfamilytherapy.com. So in this video today, we wanted to talk to you about the Safe Place exercise. What we're going to talk about is who's the exercise for, what actually is the exercise, what's the purpose of it, when you should use it, how to do it. We'll give you an experience of practicing the exercise, and then some tips and tricks about how to adapt the exercise for working with children and young people. There'll also be some handouts available on our website as well. So just to remind you guys that this is an educational video, and so this is put together for professionals in the counselling and mental health field. That means the video is not therapeutic advice, our recommendations, and if you do need support, we really recommend that you seek professional support if required, and also a gentle reminder to make sure that you're working within your scope of practice.
Okay, so who is a safe place activity for? You can use this activity for any age range, from children to teenagers to adults, and it's primarily used for clients who present with anxiety, stress, if they become distressed, and for those clients who have been affected by trauma. But keep in mind, you have to use your clinical judgment, and you need to decide, is this technique going to be useful and helpful for my particular client? So what is it? The Safe Place exercise is a technique for clients to access a positive memory in order to induce a positive, explicit and implicit memory state in their mind and in their body. As you know, clients will come to you talking about negative memories, negative stories, or upsetting thoughts or images that they're having. And when they're focused on those things, then their body reacts by feeling distressed. So the Safe Place exercise is helping your clients to find those positive memories or moments or experiences. And when they actively recall them and focus on them, then the brain and the body releases feel-good chemicals similar to that was experienced when that memory was first experienced or created. And so what is the purpose of this exercise? Well, in clinical practice, you can use it as a psychoeducational tool to help your clients understand the link between memories and what they're focusing on in their mind and the influence on their body. And you can talk about the impact of that, how they can be in control in a positive way. You can use a Safe Place exercise to reduce affective intensity in a session if your client is getting stressed in the therapy room. It's a great way to end a therapy session so that your client can walk out in a positive affective state. It is great for clients to be able to use this at home whenever they need it. And if you work with more than one person in the room and you work with significant others, then you can teach those important people how to help your client to access the Safe Place activity and exercise when they're supporting that person outside of the therapy session. So when to use it? Now, in clinical practice, it's great for clients to walk away with techniques as early as possible, but you must use your clinical judgment about, is this the right time? Do I have a good enough alliance with my client? Are they ready to use the technique? Will they benefit from the technique? So you can use it in the session when your client experiences distress or you see them becoming stressed in front of you. You can practice it in each session to build confidence and competence, or whenever is needed. Now, some clients are very creative and they prefer visual things that they can focus on as opposed to visualizing in their mind. So for clients that like to draw, they might draw their safe place. They might find a photo that reminds them of their safe place and they can keep it with them. But just remember that each person will have their own unique safe place. So even though we're family therapists and we work with whole families, this really is a strategy to develop with each individual person. Now let's run through the procedure. We'll run you through the steps and then we'll run you through the exercise so that you can experience it for yourself. So the first thing to do is explain to your client what is the safe place exercise and why would they use it? And that's what we've covered already so far. The next step is to invite your clients to engage in the activity if they choose. You may ask your client to close their eyes if they feel safe enough to do so. However, with some clients, it's often best to suggest just to soften their gaze and not to close their eyes. You prompt the client with, think of a place where you feel good, where you feel calm, relaxed, protected. You might prompt with, it might be a place in your life right now, or a place you knew in childhood. For clients who find it very difficult to access those memories or those times in their life, you can prompt with, it might be an imaginary place. So you spend time accessing and finding a place or a moment or a memory where they did feel good, protected, and safe. And then you ask questions, where is it? And you prompt your client by saying, imagine that you are there right now. So you're finding the memory. After this, we want to activate the senses within the memory. So you'll prompt with questions such as, what do you see? What do you hear? What do you feel? What do you smell? You can then prompt by asking your client in the memory to look to the left, to look to the right, to look up, to look down, etc. Really activating the sense is important, and it's the details, really connecting to those details, that will help your client really connect with the positive feelings associated with that memory. Now, of course, a little bit of a caution here. If your client feels uncomfortable with body-based interventions, then please use your clinical judgment to think about what would be most safe for your clients in this experience. To then deepen the experience, you ask your clients to relax and really enjoy the experience. So you might say, take a few deep breaths and enjoy the experience. Notice how this place makes you feel. Notice how your body feels. And then we're empowering the client by suggesting to them that they can access this safe place and feeling anytime that they choose. When the client is deep within this visualization, you ask the client, if this safe place had a name or a title, what would it be? And what we're doing is we're finding an anchor. The title could be such as the title of a book, or the title like a movie title. It's really important that you record that information, because then you can use that as the anchor when needed down the track. To help your clients really appreciate the strength of this activity, then you can guide them to test the strength of the safe place. And so you invite your clients to come out of their safe place just temporarily, and you invite them to think of a very minor upsetting memory that was a bit annoying or frustrating recently. Now, it's very important that you encourage them to pick a minor memory or moment, and it could be stuck in traffic that morning, the kids didn't get out of the door on time, or the dog ate the shoe, etc., etc. And so you ask them to really focus on that very minor upsetting memory. And again, you get them to notice, how does that make you feel in your body? Now, as they viscerally experience the tension or feeling uncomfortable from that upsetting memory, then you ask them to go to the safe place. And so you might say, now go to your safe place, or use the title that they nominated before. So now go to your safe place, go to your safe place, and then go through the details and the imagery and the senses again. And you get them to notice their body, and you get them to notice the difference between focusing on something that is upsetting and focusing on something that induces those positive feelings. But really, to truly appreciate how powerful this can be and helpful this can be, it's important for you to give this a go as well. So let's run through the safe place exercise if you feel comfortable to, so that then you will know what the experience is like, so then you'll be better equipped to be able to coach your clients through this as well. So I will invite you now to either close your eyes if you feel safe to do so, or to soften your gaze. So just take a moment, get nice and comfortable. Think of a place where you feel good, where you feel calm, where you feel relaxed, where you feel protected. It might be a place in your life right now, or it may be a place that you knew in your childhood. It might be an imaginary place. Where is it? Imagine that you are there right now. In this place, what do you see? What's in front of you? Look over your shoulder to the left. Look over your shoulder to the right. In this safe place, what do you hear? In this safe place, what do you feel? Are there any enjoyable smells in this positive memory? Just take a few deep breaths and really enjoy this experience. Notice how this place makes you feel. Scan your body. Notice how your body feels. Know that you can access this safe place and this feeling anytime that you choose. If this safe place had a name or a title, like a book or a movie, what would it be? Name your safe place now. To test your safe place, just for a moment, step out of your safe place. And now focus on a very minor, annoying thing that has happened to you recently. Nothing too big, nothing too major, something that just was a bit irritating or a bit frustrating. Now think about that. Think about what happened. Where was it? Who was there? What was going on? Now check in with your body. How does your body feel? Notice if it's feeling a bit tense, a bit irritated. And now pause. Now actively go to your safe place. Go back to your safe place. Go into that memory. See what you can see, feel what you can feel, hear what you can hear. Go to your safe place. And now notice how your body feels. And notice the difference, how you feel when you're in your safe place. Okay, that is the end of the activity. So now we would invite you to open your eyes if your eyes were closed, or to come back and be focused on the screen with Leonie and I here today. So a few tips before we get to some tips on working with children. So the visualization really can be strengthened when you're involving all of the senses and getting people to activate all of that. Choosing a person as the safe place can bring mixed feelings, because as much as a positive relationship will exist between people, then life does throw in curly ruptures and repairs along the way. And so it is best to help your clients pick a place or a location. It's important that you watch your client for their nonverbal cues when they describe their safe place. So when you're in that first stage and you're looking for a positive memory and you're thinking about, is it someplace now? Is it someplace in childhood? And they mention somewhere, have a look. Do they visibly look different? For example, are they smiling? Do their eyes smile? Do they look more relaxed? Does their tone of voice change when they tell you about that safe place? It might take a little bit of time to find the safe place, and that's really key and important. So don't skip over that step. You might try lots of different scenarios and test a little bit to see if the client, how they feel differently, testing out each one. If your client gives a generic answer like, I like the beach, or I like being in a rainforest, then again, what you might have to do is dig down on the details for a particular moment on a particular beach. because that will give you the details and the visceral experience that you're looking for. Okay, so now here's a few tips on working with children.
Okay, so main tips with working with children are really understanding the difference in development, and not just in terms of their chronological age, but really thinking about their emotional age, because we know that kids reach different milestones at different times, especially if they've had some particular troubles in their early years. So start to think about the young people that you're working with, and then think about how you can adapt the exercise. So what we want to talk about are some tips for what the actual exercise looks like in terms of some additional steps for scaffolding the exercise, and then also some fun ways to use it for a child-friendly practice. Okay, so my first tip is just additional scaffolding. We want to keep the core of the exercise exactly the same in terms of that richness of details and accessing all of the different senses. But for some young people, that can still be a bit of an abstract concept. So we want to make it really nice and concrete with this extra scaffolding and introduce a metaphor like a TV metaphor. Most young people these days are pretty familiar with the use of screens and different types of TV shows they can watch. So you want to say something like, imagine the bad memories and worry are like watching a giant screen TV in your living room, and you feel like you're stuck, but you can change the channel just the same way you change the channel on the TV. And then deepen the change the channel metaphor. So spend some time talking about different channels, how to change the channel, really help the young person understand that they know how to change the channel on their TV, and now they're going to learn how to change the channel using their brain to change the way that their mind and body feels based on the picture that they're watching. Okay. For child-friendly practice, my top tips are think about different mediums. So you might have an older teenager who loves the adult worksheet that you'll find on our website. You might have a younger teenager or child who thinks that the child version of the worksheet is terrific. But you might also have some young people who need to do lots of drawing. So if their safe place is that particular beach from a particular time, then they might be drawing that beach. They might be doing an internet search to find pictures of the beach and even making a collage. So using as many different creative mediums as possible that suit with the young person and where they're at and what works for them. You might also find for child-friendly practice that you have to do the exercise in chunks over a few different sessions. So one session might be all about the TV metaphor and the idea of changing channels. And then another session might be thinking about what the safe place is. So don't feel that you need to rush. It's really important to use your judgment and to go at the client's pace. And then my third top tip is to match your style to the young person whom you're working with. So for example, if you've got a really tech-savvy young person, you might be thinking, how can I introduce the idea of the safe place metaphor? How can I get them interested in this idea of using their brain to change the way their mind and body feels? And so you might have some resources of your own. You might have some great YouTube clips about anxiety, maybe some cool cartoons that you share and introduce with a young person to join with them with where they're at, and then help them start to think about how the safe place exercise might be as use to them and if they want to choose to do that. So again, if you've got a young person who loves drawing or art or craft, just really stick with where they're at and what works for them. And that's the end of our presentation for today for Education for Professionals on the Safe Place exercise. Now, if you found this really useful and helpful, you can subscribe to our YouTube channel. You can also subscribe to our monthly newsletter. We'd love to share resources and information. You can join us for professional development workshops, and you can find out more about our advanced certificate in systemic family therapy on our website. Thank you for listening, and goodbye from me.
And goodbye from me, and we hope you enjoyed today.
Thanks.